Hello, welcome to my channel. I'm Dr. Erica, pharmacist. Thank you for joining me for today's chat. I'm going to talk to you about anemia. Anemia um, is a condition of the blood system, the red blood system. Red blood cells do not produce adequate amounts, or there might be a deficiency in iron or other proteins besides the red blood cell itself that may not be enough to carry a full amount of blood cells and blood particles through the body. So anemia, very serious. It has to be diagnosed. Again, it has to be blood has to be taken. Laboratory examinations have to be done as well. And I want to talk about iron and folic or acid or folate, which is also B9, vitamin B9. So iron comes in different formulations: liquid, tablets, capsules. It is over the counter at 325 milligrams for 65 milligram uh, elemental form, and then it is also immediate strength release and it's extra strength release. It comes in over the counter. Also, it comes in prescription form. So what I'm going to talk about is iron in general. Iron in general, again, is immediate release 325 milligram or 65 milligram elemental. When I say elemental, that means that only 65 milligrams of the 325 milligram capsule is actually taken into the bloodstream, actually beneficial to the body. The body actually uses 65 milligrams elemental. Okay, now iron is it's a hematological agent, and it is again over the counter. It can be picked up at any time. It's readily available. It's cost effective, meaning that usually there's a good discounted price attached to it. Also, iron is it helps carry it helps the iron is what it does in the red blood cell. It helps attach to the red blood cell, and then the red blood cell carries the iron throughout the blood, and that gives the blood its red tint. Oxygen does also, but the iron also gives a red tint in the blood as well. And so without the iron, anemia occurs. Red blood cells can't be produced properly, they can't form properly, and so they experience a cell death or apoptosis where they're not functioning, they're not produced at a adequate amount. Iron can have side effects along with it at extreme levels or extreme amounts in the body, and that can be constipation. It could be nausea and vomiting reaction. Also, it could be diarrhea as well. That was surprising to me because usually too much iron can cause constipation, and we usually, as healthcare providers, ask patients to take a laxative or a stool softener when taking a product like iron, because constipation is its main side effect. Okay, it has some drug interactions with antibiotic therapy, such as the tetracyclines and the quinolones. It also has an interaction with levodopa for Parkinson's disease. And then also with antacids. When you're taking an antacid, separated by 2 to 4 hours from iron therapy. Again, separated by 2 to 4 hours for iron therapy, antacids. Okay, and again, it's readily available, and the diagnosis usually occurs again in lab, and it has to be detected. Usually, it's undetected until the patient says, okay, I'm experiencing some sort of coldness or some sort of a lack of energy, or I'm not active like I was. So the doctor will either give you a recommendation to take a multivitamin that helps boost energy, that has iron, elemental iron in the capsule, or they'll go further if that doesn't work to do laboratory tests, actually testing and pulling samples to test for the iron count and any other possibilities of other any other causes such as red blood cell deficiency or iron deficiency or folate deficiency. So they'll do that. They'll do those tests to make sure and rule out that it is particularly an iron deficiency. Iron is good also for pregnancy and those who are expecting. It helps with fetal development as well. And then also, it should be taken on an empty stomach. The immediate form, the immediate form, which I mentioned earlier, 325 milligrams, should be taken with the empty stomach. Full stomach should be with the extended release form. That is the 160 milligram form, should be taken with food for absorption, adequate absorption. And then again on an empty stomach for adequate absorption of the immediate release. So that's all I had today for iron. I'm going to move on to folate or folic acid. Folic acid, which also has several names. It has a name: vitamin B9, folate, folic acid, and then it also has another scientific name. When you see it over the counter or when you see it on a prescription, it's usually going to say folic acid or it's going to say folate. Okay. It won't usually say vitamin B9. It'll just say folic acid or folate. Folic acid is very essential to unborn fetal development. It helps the neuronal tube, the spinal cord, to form properly. Also, it helps reduce anemia in adults and in adolescents and juvenile and kids as well. Doctors will rule out other possibilities for anemia before they decide on folate deficiency and going further to give a prescription for folate or a recommendation for folate over the counter. It comes in several different strengths, 0.4 for over the counter, and then higher strength, double strength, up to 1 milligram for prescription. So folic acid is a vitamin B9 that works to help with synthesis of purines and protein and DNA functioning in cell cycling. Also, it helps with producing adequate red blood cells in the body. So patients who have anemia, you might see that they're also taking folic acid or vitamin B9 or folate. Folate is a vitamin that is readily available over the market. It's usually at a discounted price. The pricing does not usually skyrocket or anything like that. And then it's also manufactured on a regular basis. It is, again, affordable, and it provides assurance of the fetal development. So those who are expecting should be on a folic acid normally. There is one drug interaction that's very serious. If you're on a medication for anti-seizure medication called phenytoin, phenytoin is a anti-seizure medication that interacts with folic acid, and folic acid interacts with phenytoin. So do be aware of that particular drug interaction if that qualifies for you. It comes it's usually comes through the diet. Folic acid comes through the diet, a healthy, rich vegetable and fruity diet. Normally, you get your folate that way because it is a vitamin and it is recycled through the body. So patients who have liver disease or patients who have intestinal disease may not experience adequate folate absorption because folate is reabsorbed through those two organ systems and back into the body. Okay. Folic acid and iron are readily available. They are medications that I have seen and have dispensed over a period of time, and I do hope that um, with consistency and persistence, that anemia can be ruled out as a disease state. um, Again, it has to a patient has to go through laboratory testing to be diagnosed. It's not just something that someone just decides to take on their own. It's a medical condition that has to be laboratory approved. And I do hope that the information that I shared today was very informative and beneficial. And if you have any comments that you would like for me to go over, or you have any topic discussions of choice, please let me know in the comments section. And I hope to see you on the next video chat, which will be happening very soon. Thank you for joining me. Please subscribe. There's a little button in the right side of the screen that you can actually push, and you can like, comment, please. And I hope to see you on the next video. This is Dr. Erica. Thank you. Bye-bye.